Welcome, everybody. My name is Marty Mascari. I am a contractor with the North Central Texas Area Agency on
Mm.
Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. Both of these programs are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. We are blessed here to have my cohorts with the Area Agency on Aging, Simon Manrique and Melinda Gardner. We are blessed here to have Valerie and Angel here with the Better Business Bureau Education Foundation in Houston as well for presenting our midweek Medicare on mental health benefits and durable medical equipment scams. But before we get started, I want to go over CEUs, since I know many of you are joining us for CEUs today. We're providing complimentary CEUs for licensed social workers and licensed professional counselors in the state of Texas. And since you can't see really who I am, you really don't know who is really offering the complimentary CEUs, but it is us. So we are offering complimentary CEUs again for licensed social workers and licensed professional counselors in Texas. We are also offering certificates of attendance to those of you that would like one. For those of you that have different licenses in Texas or a license outside of Texas, you're more than welcome to go through the process and get a CEU certificate and present it to your jurisdiction, whoever oversees your licensing. And I've had many people tell me they've been able to use them, they've taken them. And I also have had some jurisdictions reach out to me for additional information on programs we've done to see if they qualify for meet their threshold for their CEU requirements. So you're more than welcome to go through and get one, but please just understand that it's totally up to them if they accept them or not. And there's really not a whole lot I can do to change that if they're not willing to accept it. Today's webinar is worth 1.5 hours of CEU credits. You must complete the entire live webinar and the Q&A up till 11:30. I realize that's what we've advertised, and many of you have other appointments. As long as you stay on till 11:30 and you've been on for the entire time, you're good to go. You also must complete the Google evaluation survey. Zoom, when your closeout today, should offer to have you take a short survey. That is our Google survey, and that will suffice. If you don't get it through Zoom, you'll also receive it in a follow-up email that will go out later today. The survey, again, will be in the email. It's open till next Friday for you to take that. And please give us about a month from then to get the certificates out to you. We're working on getting caught up, but we had some really big webinars in the last couple of months with lots of people, and those have taken us a lot of time to get certificates out to. So we're working on it. So give us about a month from then to get it. But if you don't have it by then, please reach out to me because we do have problems from time to time, and I apologize for those. So I'm going to turn it over. Melinda, do you want to introduce Simon? You're on mute.
I definitely can, although he does not need any introduction. But
Yeah.
thank you, Marty. And I just wanted to let everyone know that there is a Q&A. And so if you do have any questions, please place those in the Q&A section so that we can monitor that and get to your question more efficiently. We will be providing the slides later um, after or are we providing it during the presentation, Marty? I guess he's off. Okay.
Yeah.
But you will receive the presentation slides. This is Older Americans Month, so we do encourage everyone to share the information. Let others know about midweek Medicare so that more people can be aware of Medicare benefits, Medicare options, and then also all the scams that are taking place. So, without further ado, I want to introduce my colleague, Simon Manrique, who will be telling us about Medicare mental health benefits.
The slides are
Alrighty.
in the chat.
Thank
Okay.
you.
The slides are in the chat. Thank you.
I'm gonna share my window. Let's see here. Is it this one? Okay, trying to get to it now. I just got to it, so here it is. I got it.
All right,
Okay.
wonderful.
Are you seeing it?
Yes, sir.
Okay, good. Well, again, good morning. My name is Simon Manrique. I'm a benefits counselor here with the North Central Texas. But mine is with Blake. There's it's Council of Governments. I'm sorry, North Central Texas Council of Governments. I've been here with this company for a little over 6 years, and have enjoyed every moment of it. More so because I'm able to talk to individuals and explain to them what their Medicare benefits are. Dealing even with Medicaid a little bit, but more so with the Medicare aspect of things that individuals call for, and that's what it is. So again, welcome. Thank you for attending. And just to think moves a little bit faster than I expect. As far as our benefit counselor team, as you can see, Leslie Kilton is also a benefit counselor here. I have Felicia Warner, that's also with us counselor, and then there is me in the middle, myself, and then our fearless leader, Miss Melinda Gardner. Please take note of our phone number. So if you have any questions, any concerns, anything you think that we can help you with, please feel free to give us a call. Our main number is the 800-272-3921, and then you can see our extensions. And again, these slides will be available for y'all, so you can see our extensions. So if you need to get a hold of me, Melinda, Leslie, Felicia, please, by all means, get a hold of us. We're here for you, and we'll help you in any which way that we can with any information that you may need, and try to make the whole situation easier for you. Okay, I thought, bam. Also, you can reach me by email. There's my email address, and yeah, the days and hours that we're here Monday through Friday from 8 a.m. to 5 p.m. And I am also we are available through the CHIPS program, the State Health Insurance Assistance Program. CHIP is federally funded. The CHIP program was established by Congress, and their work is funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. Also, with CHIP, just to give you a little snapshot of CHIP, there are 54 different CHIP organizations across the United States. There's one in every state, including Puerto Rico, Guam, District of Columbia, and the U.S. Virgin Islands. Through CHIP, individuals have access to about 2,200 local programs. Between all of us, there's about 12,500 counselors available to individuals with information that they would need. We have done between all of us a little over 4 million individuals, or reached out to 4 million individuals and educated them as best we could with the information that is available to those individuals. And as far as person-to-person sessions, 2.5 million counseling sessions is usually what we go through. So CHIP, again, State Health Insurance Assistance Program. And this is a generalized idea of how we can help you. We help you to understand the cost and coverage, Medicare, Care, we compare options. We can also help you enroll or change plans that are available to you that Medicare offers. And of course, we also help individuals with trying to correct billing issues that they may have. A lot of individuals, I know I get the calls with the billing. Hey, I had this I'm getting this bill from this doctor and he didn't do this, they didn't do that. So those kind of issues as far as billing is what we do deal with also. CHIP, State Health Insurance Program. This is where you can go to find a local CHIP organization. You can visit the chiphelp.org website, and then it's gonna show you this orange tab that says Find Local Medicare Help. You can use and click that orange tab again at the chiphelp.org to find the CHIP program that's in your particular state. Or you can also call and say Medicare when prompted to be transferred to your particular state CHIP uh, individual. Do you have free time? Which sometimes we do, sometimes we don't. But if you do, it would be great for you to help out with the CHIP program. Again, navigating. We help individuals to navigate through Medicare. Cannot tell you how many times individuals have called and they're like, I'm getting calls from here, I'm getting mails from there. I don't know what to do as far as what my Medicare options are. Had an individual the other day call me. I don't know which way is north, south, east, or west, and I need help. I need to know what my Medicare options are. And of course, this is where we come in and we can help individuals with that. Oops. Yeah. I went to sorry, hold on. Let me go back. Sorry about that. There's a little presentation that we have just to give an idea of the CHIP program, what it offers and all that. And then if you can just listen to this real quick, sure do appreciate it. Let me get it started again. Here we go.
I'm not sure if sound is on, Simon.
Simon, you're gonna
Is it
have
not
to
going through?
you're
Can you
gonna
hear it?
have to turn on your computer
You-
sound sharing.
Right.
I didn't do that to begin with, I don't think. Well,
You
let me.
explained it, so I think we're
Yeah,
good.
I explained it. Yeah, we're good. Okay, fantastic. Y'all are amazing. So here, again, when a lot of times when we explain ourselves, I am with the Area Agency on Aging, and these are some of the services that we offer for older adults and family caregivers organization. We do help individuals that take care usually they take care of their grandparents, they take care of their older mom and dad, and then not only with us as far as the Medicare information, but then there are resources that are available to individuals that call us. And of course, there are certain things that I am really familiar with that I can explain to individuals about services that are available to them. And then we also have a department. It's called the Aging and Disability Resource Center. A lot of times we just refer to it to the ADRC, which is again Aging and Disability Resources. And when it comes to that, where individuals are looking for particular benefits that are available in their area, I'll transfer them to the ADRC department to help them. Now, here where we are, the North Central Texas Council of Government, we cover the 14 counties that surround Tarrant and Dallas counties. So whenever somebody from Tarrant County or Dallas County calls us, we refer them to their particular county. But we work with the 14 counties that surround those two counties. So we cover a huge area, a lot of individuals. The counties are different as far as density wise through population. Some of them are very populated, some of them are not. So a lot of different resources that are available depending on the county that you live in. And the ADFC department helps us a lot with that. Again, free services for people of all ages with disabilities and family caregivers. A big part that we help in the caregivers. So, sometimes you need to get away. Sometimes you need help with that individual because it's I was talking to an individual, and the individual was telling me she was telling me I have to take care of my kids, I have to take care of my husband, I have to take care of my house, I have to take care of the finances, and then I have to take care of my mom and dad. So, and I was like, hey, guess what? There's some help that's available for you for this, and that's what our ADRC department does. Volunteer opportunities. One of the biggest things that I like about here also is that we look for volunteers to help us, because I hate to say it, but everybody sooner or later somehow needs help in dealing with this. And a lot of times it's so much of the information that's available to individuals. And our volunteers are great, 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 great individuals that help us also spread the word about what we do and how we do it to get them the information that they need. And if our volunteers, a lot of times, sometimes an individual will ask a particular question, and they refer them to us, and they're like, hey, Jan sent me to you, and she told me that you are familiar with this and I need this information. Yeah, perfect. Volunteers are great. So there is an opportunity for individuals for you to help us out by volunteering and spreading the word about what we do. Program opportunities through the volunteering. You can volunteer to be a benefit counselor, just like us, just like me. Help with the public and private paid benefits, entitlement programs, and legal rights. One big program that's going to be talking after me, the Senior Medicare Patrol, which helps prevent healthcare fraud by conducting community and outreach education services. Uh, Ms. Valerie, Ms. Angel, they were talking about some of the things that they do, and across the state, going out doing the presentations. They've even been here and done a presentation to us to bring us up to date as to some of the things that are going on, which again, they're going to be part of the program. Long-term care ombudsman, taking control of your health evidence-based programs, and this is based on rigorous study. And these programs help participants better manage chronic conditions and reduce risk of falls. Volunteers choose how and when to serve. It's not like you have a schedule and you have to do it at this time, at this point, with this person, no, it's your choice. It's when you can and how you can. Again, the volunteer positions, benefit counselor, senior Medicare patrol. Uh, you select There are select opportunities that meet the needs and goals of individuals, consideration for skills, interest, and scheduling. Uh, we have a clear background verification process that we go through for the volunteers. And then, of course, as a volunteer, you would also receive the continuing education that we offer. So you keep you up to date to some of the changes that are going on from year to year to year. So it's good to be uh, uh, educated or reminded or trained for any additional information that you may need to be able to reach out to individuals. Bam. This month, May is Mental Health Month. So I'm going to get into this portion of the information that's available to you that you can utilize to deal with the mental health benefits that are available to you through the Medicare. Mental health is not an easy situation sometimes. It's can take you in so many different directions. And again, I think several of us, not all of us maybe, but several of us have been in the situation of trying to help someone that we know with the uh, mental health. I know when I first started getting into it, some of the things that they were talking about as far as, what is mental health, and again, trying to get to it and understand it was a little eye-opening for me. But as far as this presentation, the objectives for me for today are going to be to try and get you familiar with the Medicare health benefits, what's covered, would you have to pay, and where to get more information. To begin with, getting started. Mental health conditions like depression, anxiety can happen to anyone at any time. And of course, You want to be able to talk to your doctors about that to let them know. As far as mental health situations, conditions, again, that may be available. One of the biggest ones as far as with mental health is thoughts of ending your life, because everything, like I was talking about that individual earlier, she was talking about, she works, she's got her house, she's got her children, and then she's got her husband, and then the finances, and then you know taking care of her parents, taking care of her grandparents. All of that can be so hard on an individual, and so you're trying to deal with things. Yeah, sometimes you can get as far as thoughts of ending your life. You get sad, you feel empty or hopeless, feeling that way, low energy, trouble concentrating with everything that's going on, trouble sleeping, increased use of alcohol or other drugs sometimes is what individuals will resort to try and get some sort of relief. What's covered? As far as the Medicare Part A hospital insurance, it covers mental health care services if you're admitted as an inpatient in a general hospital or a psychiatric hospital. A facility that only cares for people with mental health conditions is considered a psychiatric hospital. Medicare Part A also covers semi private rooms, meals, general nursing, drugs, including methadone to treat an opiate use disorder, other related hospital services, and supplies. If you're in a psychiatric hospital instead of a general hospital, Part A only pays for up to 190 days of inpatient psychiatric hospital services during your lifetime, and of course, that is through Medicare Part A. There is a way that uh, you can check if you want to see how many days you still have available for you, and you can you'll see it on the Medicare summary that you get. Usually they send it out every 3 months to you to give an idea of what happens. Which we highly recommend that you look at that Medicare summary to see. It'll indicate which doctor you went to and basically what you were treated for whenever you went to your particular doctor. So that Medicare summary is fantastic. I always try and let individuals know, look at that, because you never know. There are fraud is a big part of Medicare sometimes, where doctors try and uh, I'm kidding, where doctors will try and bill more than what is actually available to you. Hold on, my phone is ringing. I thought I turned that off, but anyway. So yes, Medicare Part A hospital. And again, there you have the general hospital and psychiatric hospital services that are available to you, and that gives you a general idea of what's covered. That was Medicare Part A. This is Medicare Part B, which is usually your medical insurance. Part A, of course, covers your hospital services. Part B covers your doctors and their services. Medicare Part B helps pay for mental health services that you usually get outside of a hospital setting or services a hospital provides in an outpatient department. I've seen it plenty of times where hospitals will have a separate department for mental health services that they offer. Some Part B covered mental health services include individual or group psychotherapy. A lot of the hospitals offer these individual one-on-one services, or more so what I've seen a lot is the group psychotherapies that they offer for you to go to. Some individuals want to be private about their situation. Some individuals feel better in a group therapy to see what other individuals are going through. So that's where the group psychotherapy really comes in. Some individuals have family situations that are going on, and try and look for that type of help, that type of information as far as having family counseling. And again, if the main purpose is to help with your treatment, it's what they're looking for, to be able to offer you treatment for your situation. Sometimes partial hospitalization is involved as far as outpatient services. They offer intensive outpatient program services, and then the services you get as part of there are services also that you get rather of substance use for disorder treatment. There on the bottom, you can see where you can visit Medicare.gov, and you can go specifically to these areas, which is the Medicare.gov/coverage/mental-health-care outpatient for a general list of covered providers that are available to you in your area. So don't hesitate to do that. Also, it covers, again, here's the opioid use disorder treatment services and opioid treatment programs. I don't know if y'all remember, I guess a few years ago, there was a big deal with this pharma contract, a company that was that seemed to like to offer doctors benefits if they offered these opioids. And yeah, so there was a big opioid disorder service that were needed because of those individuals. But again, the services include medications that would cover and help you to with this opioid treatment, substance use counseling, drug testing, same pretty much any services as far as individual group therapy, intake activities, the periodic assessments, which are very important. And of course, again, the intensive outpatient programs that are available to you through Medicare Part B. Again, there in the bottom, where you can go directly to see also what services are available also to you. Because I know with us, with me, or with us here dealing with the different counties that we deal with, again, 14 different counties. It depends what's available in your county sometimes. So you need to be very careful and see what's available in your area. Unfortunately, I've had individuals that are dealing with this and live in a particular county and go to a different county, and they're like, "Whoa, wait a minute! I moved and now I don't have this service available over here." Okay, well, let's look at it. Let's see what's available for you. Also, it covers one alcohol misuse screening each year for adults, and yeah, believe it or not, pregnant individuals. And these are individuals who use alcohol but do not meet the medical criteria for alcohol dependency. And there's a website that you can go to get some information. If you have a substance use disorder or a co-occurring mental health disorder, you can also get telehealth help. Meaning you can talk to a particular doctor over the phone instead of, I don't want anybody to see me going to this doctor's office because, maybe where the doctor's office is, you can see, mental health treatment kind of thing, and individuals want to be a little bit more private about it. So believe it or not, telehealth is one of the services that is available to you where you don't have to go to the doctor's office and you can talk to the doctor over the phone, explain the situation, and then of course the doctor can help you. And again, depending on where you're at, you want to look and see if the telehealth services are available to you. Part D, there wasn't too much as far as Part D, but I will tell you the doctors are familiar as far as the Medicare drug coverage that is available to you. They, again, it's like an everyday thing for them. So depending on your situation, what you're dealing with, what you're going through, they can help you and tell you, okay, these are some of the medications that are available to you. They go through, they're very thorough as far as explaining to you what each medication does and then what Medicare covers for the particular medication that you can need. As you can see, Part D helps cover drugs that you may need to treat a mental health condition. Medicare drug plans are required to cover nearly all antidepressants and antipsychotic medications also, because again, their objective, of course, is to help you with any situation and condition that you're having to deal with. As you saw earlier, there was a broad scope of things or situations that you consider as far as mental health. It's just varies from what you're dealing with and the type of help that you need. What do I pay for inpatient mental health services? You pay this for each benefit period. If you were admitted, and again, this is inpatient, from day 1 through 60, you would be responsible for the Part A hospital deductible, which is $1,676 this year. If you're in there for longer than between 61 and 90 days, coinsurance amount is $419 each day. And then from day 91 and beyond, a coinsurance amount for each day is $838 while you're using your 60-day lifetime reserve days. If you're not familiar with that, you can look it up. A lot of time a lot of individuals that use up these 60 lifetime days is individuals that are really dealing with not necessarily mental, but also these are available to you for individuals that are in the hospital. And it's kind of like they get to the point to where they're not quite sick enough to be in a hospital, and then they'll go into what's called a skilled nursing facility, and then they're not good enough to go home, and they're in a hospital-based type situation, and they're in there for like several months, and sometimes they'll have to use up their lifetime reserve days. Again, it's not something that individuals use up very often, but if you have to, those days are available for you. And once you use up those days, they're gone. You never get those back. And then, of course, each day after you use up all your lifetime reserve days, you are responsible for all the costs. And again, Part B covers certain doctors' services, outpatient care, medical supplies, and preventative services. This includes mental health services you get from a doctor or another healthcare professional if you're admitted as a hospital inpatient. Again, this is inpatient, not as outpatient. And of course, you pay the 20% of the Medicare approved amount for these mental health services that you're dealing with. Mhm. For prescription drugs, your costs will vary depending on if you have a medical drug plan, and of course, which one you have. If you have limited income resources or meet certain criterions or conditions, you may qualify for extra help from Medicare to help pay for the cost of your Medicare drugs. Extra help is a program that is available to individuals, again, that are low income because, again, well, came up here as limited income, but I like to refer it as low income. If you're low income and limited resources, you can apply for extra help, and extra help helps you with the cost of your medications. You'll pay anything from $3 or less for your generics, and then now your stronger medications, yeah, your copay may go up, but it's not going to be the full amount that you're going to be responsible for if you are on extra help. We help you also apply for the extra help if you're low income and have limited resources. As you can see, the websites are available there that you can go to get any necessary help that you might need as far as if you are low income and limited on resources. Be more than glad to help you. Give us a call. We'll help you to apply for that extra help also. Oh, goodness, I'm sorry. You need to know what your rights are. No matter how you get Medicare, you have rights and protection that provides you with your safety when you get health care. It ensures you to get the health care services the law says you can get through Medicare, shields you against unethical practices, and it safeguards your privacy. Again, for more information on your Medicare rights, there's the website down there that you can go to, or you can even call Medicare directly. Call Medicare and get them to because depending on where you live, again, to get the information that's available in your area. If you're in our area here, my God, please don't hesitate to give us a call because we're here to help you as best we can with the information that you need. Where can I get the information that I need to be able to help myself or help somebody that I know? There's a lot of different. There's a lot of help out there, and individuals are not familiar with it. I can't tell you how many times I've gotten calls and people ask me this basic questions. Again, Medicare. what am I gonna what options are available for me through Medicare? There's some individuals that didn't have insurance because they couldn't afford to buy insurance, and then here they are. Okay, I'm 65. Finally, thank God, I qualify for Medicare because I'm 65. What are my options? And then I go through the rigmarole of explaining original Medicare, the standalone prescription drug plan, and possibly even the Medigap policies that are available to them, or then you have the private or commercial insurances that are available through excuse me, to individuals through the Medicare Advantage plans that are available again through the private insurance companies. Medicare has subcontracted with several private insurances, and that these Medicare Advantage plans offer that coverage to you. And again, it may vary from county to county or from area to area that you live in, state to state. Not necessarily what's available here in the 14 counties that's available here in our area are available to individuals in different states and everything. But you can look your CHIP program. You can call your CHIP state program, and it'll give you the health insurance counseling information that you need and tell you exactly what's available in your area. More information as far as mental health services. You can visit the mentalhealth.gov or contact. Here are some of the websites that or entities that I found that are available. Again, there is so many different entities that are available. Here, the National Institute of Mental Health. There's a website. There's a phone number that you can call to get the assistance that you need. Substance Abuse and Mental Health Services Administration. There's the website, phone number where you can call. Mental Health of America. It's available. The National Alliance on Mental Illness. The National Council for Mental Well-being. When I came upon this, I was like, oh my goodness, I didn't know all of these entities were available for you to utilize. And I knew some of them, but not all of them. But still, like I said, it's just part of our job to, again, try and give you the information that you need, that you can utilize to get the services that you need, the help that you need. And again, of course, cost has a lot to do with it also, and that's what you're looking for, something that is available. Again, resources that are available to you, and here are some of the ways you can find out. Again, call your state health insurance assistance program, CHIP. There's a toll-free number, and then there's the website that you can utilize to get the help that you need. Again, I can't say it enough. There is help out there for you. One of the biggest one that I like to push is the Senior Medicare Patrol. When I send information to individuals as I'm talking to them on the phone, I also let them know about fraud and abuse that is out there, that you gotta be careful with it. I've explained to individuals right now, an individual, a fraudulent individual, a scammer, if they get a hold of your Medicare number to one of these scammers is guesstimated at about $30,000 a year that they can obtain fraudulently with your Medicare individual number, just yours. So imagine if they were to reach 10 people and get their Medicare number, fraud, abuse, huge. But again, who's bigger than all of that? Our Senior Medicare Patrol that's available to you, where you can contact them and let them know, hey, I think something funny's going on here with this doctor. Something's going on funny with this facility. Call them. They are available to you. Again, Medicare resources. Again, these slides are going to be available for you. Here's CMS. A lot of us refer to instead of going through the Centers for Medicare and Medicaid Services, just CMS. So over to you. Individuals that are, renal disease. There's this website that they can go to get help. Medicare beneficiary ombudsman. Our ombudsman program is the go-between between individuals and the facilities that they are in, as far as like they're in nursing homes, and our ombudsman help individuals, the go-between, because a lot of times individuals are not satisfied with the services that they're getting from their nursing homes and all that. Ombudsmen are great, great, great God-given individuals that help can help you if you know someone that's in a nursing home and they're having issues with the facility. Contact your nearest ombudsman in your area, and they'll help you. Again, the skilled nursing facility rights, the U.S. Department of Health and Human Services, which yeah, I refer to as HHS, the Health and Human Services Commission, Medicaid. It's also like Medicaid, and Medicaid varies from state to state. I explained that to individuals. We have individuals that come to Texas. I can't tell you how many times individuals have called us from California, and in California it's Medi-Cal is what it's called in California as far as Medicaid. And of course, California offers some great services. I've had individuals that have called and coming from New York, and they have Medicaid services in New York, and then they come to Texas. Well, there's going to be a little bit of changes here in Texas, but still, there are services that are available to individuals for you to get the help that you need. Us, the state health insurance assistance programs that are available to you, depending in the area that you're in. The Social Security, that first number, the 800-772-1213, that's their main number usually that I give for across the United States. But there are localized Social Security numbers, offices that are available to individuals. So you can take it a step further, and depending on where you are, you can find a local Social Security office that you can call. Now, you need to be careful now because of some of the changes that have gone on where a lot of these offices have been closed. So look around, check, see where you can call to get Social Security benefits information. The beneficiary and family centered care quality improvement organizations, Medicare appeals. We can help you if you are trying to appeal a Medicare payment or denial. We can help you with that. You can give us a call. That state survey agency is available also, just to kind of get an idea of what's going on your area. And that is the end of my presentation. Who are we again? My name is Simon. I'm a benefit counselor, and I am part of the CHIP program. Also, I help out with the SMP, the Senior Medicare Patrol. If you have any questions, any concerns, you want to reach out, please, please, please don't hesitate. Can't tell you enough. We are here for you. We want to help you as best way we can. We want to give you the information that you need. Call us, 800-272-3921. And again, you'll see on that first slide has my personal extension, which is, I love my extension, by the way. It's 45687. Here Monday through Friday from 8 a.m. to 5 p.m. Questions, concerns, don't hesitate to call. And thank you so much for your attention. And I am done. So y'all have a great day. Be safe.
Thank you
Great.
very much, Simon. Wonderful presentation. Help us understand those Medicare mental health benefits. And sometimes when, we have some of those Medicare issues going on, it does affect our mental health. And that could be when we're most vulnerable for scams. And so SMP is going to talk about durable medical equipment scams, and I'll turn it over to Valerie.
Thank you, Ms. Melinda, and thank you, Simon, for all the extra tidbits and mentioning SMP so many times. I loved it. Let me start sharing. Okay. Are y'all able to see it? Perfect. Sorry, my voice is going away a little bit for some reason, But good morning, everyone. My name is Valerie Petriciolet with the Texas Senior Medicare Patrol. I am an outreach specialist, so we talked a little earlier about how I got to San Antonio, different places, doing educational presentations and activities like this one. Today, we are going to be talking about durable medical equipment scams, what they are, how to prevent it, and then what to do if it does happen to you. First, about our program. It is lagging. There we go. We are a completely federally funded program in every single state, and we also extend out to the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands. We specifically recruit and train volunteers and professionals about Medicare fraud, error, and abuse, and we report that intentional fraud and abuse to the correct Medicare fraud control units. Education and prevention are at the core of our program, so our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through things like this: outreach, counseling, and education. Now on to the scams. What is DME? DME is durable medical equipment. So this would be medical items that are prescribed by a doctor for use in a home. So things like wheelchairs, walkers, oxygen tanks, blood sugar meters, even hospital beds, for someone that may be receiving care at home. Does Medicare cover DME? So they do cover different kinds of durable medical equipment in different ways, meaning you may be required to rent or buy the equipment, or you may have the option to do either or, and it's usually covered by Part B. It is very important to remember that Medicare will usually only pay for the equipment if it is medically necessary. It has to be prescribed by your doctor, and it has to meet the Medicare defined criteria. It's also very important for you to ask the supplier if they participate in Medicare before you get the durable medical equipment, because if not, you may be liable to pay for the full cost of the equipment, which can be hundreds of dollars, even thousands. What is DME fraud? Unfortunately, scammers do know that Medicare covers this equipment for a lot of people, and they take advantage of that, especially regarding older adults. Durable medical equipment fraud happens when a person or a company bills Medicare for equipment you didn't need, didn't want, or you never even received. Sometimes they may send you items without a doctor's order, or they might ask you for your Medicare number to submit fake claims. Some red flags to look out for. Scammers often use different tactics to try and trick you. So you have to look out for unsolicited calls offering free durable medical equipment. Everyone receives the scam calls all the time. We say that it's best to just hang up the phone. But if you are getting caught up in the situation or they're offering free things, remember to never give out your Medicare number or any sort of personal information over the phone. Anyone that is a real physician or a real company will not be asking for this sensitive information over the phone, right? If you receive durable medical equipment at your doorstep, I think we talked about the genetic testing not too long ago, so this is very similar to that. If you are receiving equipment at your doorstep that you did not ask for, or it wasn't prescribed by your doctor, leave it where it is. You can give us a call. We tell you to not use it, because once you do use it, once you give out your Medicare number and your benefits are used, you are most likely not eligible to receive that equipment anymore. Or if you do need it in the future and you need a different version of it, you may not be able to get it. If you feel like you are being pressured into signing some sort of contract or a form with these people, ignore it. You can ask them, if you are interested in it, you can ask them, can you please provide me with a copy of it? If they're not willing to give it to you, that is a huge red flag. You obviously don't want to be doing business with a company that doesn't want to be completely transparent with you. You also want to look out for suspicious charges on your Medicare summary notice. We are always handing out healthcare trackers when we go out to speeches or at our events. So that's a really good way of keeping track of all of the things that you're being told as a doctor. So you write down if you are on new medication, if you do need a wheelchair and they prescribed it to you, that way you know, okay, the doctor did actually tell me that I need this. They actually ordered it for me. So now when you cross-check it with your statement, you can see what you are and are not being charged for. A big one is unusual forms of payment. So as I mentioned earlier, a real supplier or a physician will not ask you for money or sensitive information over the phone, but especially not via gift cards. So if someone is saying you can get a free wheelchair, you can get a discounted wheelchair, all you need to do is go buy 10 Walmart gift cards and give me the codes, that's probably not as truthful as they're being, right? Or if they say this wheelchair only costs $100, if you send it in Bitcoin, probably not. So you need to be very, very careful about the types of payments that people are asking you for. If it sounds suspicious, it most likely is. So DME fraud doesn't just hurt the government, it hurts you personally. It can drain your Medicare benefits, which may limit your ability to get real equipment in the future, like I talked about earlier. Once you use your benefits, or if a scammer uses them, you most likely have met the limit of the number of durable medical equipment you are eligible to receive during that certain time frame. Since DME is supposed to last you 3 years according to Medicare's definition. Sorry, stumbling over my words today. It can also increase Medicare costs for everyone, right? So this kind of fraud adds up and it contributes to putting the trust fund at risk. How do you prevent durable medical equipment fraud? So treat your Medicare card like a credit card. You would not give out your credit card number to just anyone. You wouldn't hand it to a stranger on the street, and you wouldn't give it out to someone you just met over the phone, right? So the same thing needs to happen with your Medicare card. You don't want to share that information with anyone that you don't know or that's not a trusted doctor. A lot of people are worried about when I tell them don't carry it around, like your social security card, you don't carry that around with you, but they get worried that maybe I get in an accident or I need to go to the hospital for an emergency. If you know that you are going somewhere where you will need it, take it. But if not, you can provide that information later on, right? If you are in an accident and you need your insurance card, you can provide it later on. Regularly check your Medicare summary notice. So that's why we provide the healthcare trackers. But if you don't have it, take a little notepad with you and a pen and write down everything that they're telling you so that you can check it with your statement at the end of the month or every 3 months, however often you get it. A big one is also shred documents with personal information. A lot of people also do the little strips, but we recommend, or I recommend, that you do the confetti. That way people or scammers can't piece together the paper that you were throwing away and shredding to try and get your information. It seems a little excessive, but they actually do that. Now, if you are a victim of fraud, Medicare fraud, the first step is to always check your Medicare summary notice, right? Because it may be that it was just an error. It may have been, you need to be checking for double billing, services not provided, upcoding. We're all human, we all make mistakes. So it could have been that you needed a wheelchair and the code was 123, but they would put 1234 and now you're getting metformin. So check your Medicare summary notice first, and then if it is an error, you notice something weird, call your provider. And if it is actually fraud, no one else is helping you, you can call us. That's what we're here for. We have someone in-house who helps you build the case essentially, and then we send it to Medicare. This is our phone number and our website. You can also just go to the S&P Resource Center website as well. If you are a victim of any other kind of fraud, since we only deal with Medicare, we usually refer you to the Better Business Bureau is where you can report it, but you can also contact the Federal Trade Commission, and this is their phone number. And then one more thing, I am inviting you guys to connect with us. This is the link to our Facebook. We're always putting different things on there. But specifically right now, we are posting about Older Americans Month and the 2 events that SMP is hosting. One in the McAllen, Harlingen area, and then the other one here in Houston. So if you are interested, we would love to see some familiar faces there. You can tell us that you found us through Midweek Medicare. Leave it up for one more second. And then if you have any specific questions about this or you are interested in a presentation, please let me know. You can contact me here. And thank you all so, so much for listening. It's always a fun time presenting.
Your mute is on, Melinda. There you go.
I keep muting, unmuting. I
Yeah.
put my headset down. Anyway, thank you very much, Valerie, for presenting for us. That was great information. And somebody posted in the chat, this is a lot for seniors to be responsible for. And true, it is a lot for seniors to be responsible for. And that's why we like to, educate the older adults as well as the younger adults, so that they can look out for our older adults. We don't want them trying to do this on their own. So it is helpful to have others aware of what needs to be done.
Yes, 100%.
Yes, yes. I didn't see any, oh, I think we do have, okay, can you assist with billing issues? Okay, depending on what billing issue it is, the ship agency can possibly help with that. If it has to do with fraud, then that is something that the Senior Medicare Patrol may be able to assist with. So I would suggest contacting your local ship, and then they can direct you whether that would be something they can help with or something that would need to go to Senior Medicare Patrol.
Janice, if you have something, if you would put it in the Q&A. I see you raised your hand. We've got over 100 people on, so it's really hard to call on people. So if you could put that in the Q&A, that would be great. I'll tell you firsthand, I'm here in California trying to help out with my mother, who very abruptly ended up in a nursing home, and looks like she's going to be there permanently from being completely independent, driving and everything. And boy, there's 4 kids. I have 3 siblings, and everybody's working on it. And so I really encourage you to especially seniors, to try to get your adult children to reach out and become educated, because I'm going to tell you, it's amazing the amount of advocacy work that's had to be done to get what she's needed. And it's only been because of pushing and pushing and pushing to get it done. And I really can't say enough about the need to get as many people educated as possible on this, because it is a huge undertaking, and you are going to find roadblocks all the way along the way that you're going to have to knock through to get them what they need. And it's a tough road, let me tell you. It's a tough road. Yeah, so
I'm dealing with something similar. My mother's not in a nursing facility, but she stays alone in her home and will be 89 this year. So we're trying to,
Wow.
make plans and doing things before something actually happens. So yeah, it's tough.
Yeah, and I'll just tell you a real quick story. My mother was in excruciating pain because of a spinal stenosis. The spine shrinks and starts pinching a nerve, and she was in absolute excruciating pain. And they had her at the hospital. They couldn't get any relief to her pain. And finally, my cousin happens to be a pain doctor for sports medicine. In fact, he actually does pain management for the Dallas Cowboys when they're at their training camp in Oxnard, California. And he said she needs an epidural. She needs an epidural. He said that's the answer. And they literally had to go back to the doctor and say she needs an epidural. And surely they've had to give her 2 epidurals to get her out of the pain that she was in. And the only way they found that out was through my cousin.
Oh,
And the hospital, and it didn't come up until my sisters brought it up after they talked to my cousin. So it's so much advocacy. It's
mm-hmm,
crazy.
mm-hmm. And then we don't want, people just coming up to the door and trying to help. And that's, sometimes what we find
Yeah,
in some of
yeah.
these situations. It was like, oh yeah, I heard you need a knee brace, and just out of the blue or something like that. So yeah, it's important for all of us to be involved and help where we can. Thank you, Marty, for sharing your personal story. All right, there's another question in the chat. Do you have to renew Medicare, Medicaid each year? Medicare is a federal program, so that does not need to be renewed every year. However, if someone has a Medicare Advantage plan or a prescription drug plan, it's important to review and look at that information each year to see if that needs to be changed. It's not necessarily a renewal, but making sure you have the one that works best for you. Medicaid, on the other hand, is a state program and you have to qualify for that. So, yes, that does have to be renewed each year. And you should receive information from Health and Human Services letting you know when it is due. Usually, it's about 3 months before the actual due, the actual annual date. So make sure you're checking the mail, make sure your address is up to date with Social Security and with Health and Human Services, services, so that you can receive that information as they are still using snail mail.
Hmm.
That's all the questions I see in the chat. I mean,
Okay,
in
well,
Q&A.
let me go back to sharing my screen if I could, and we're going to go back over the CEU requirements for today. Um, okay, very good. So for those of you that are joining us today for CEUs or for a certificate of attendance, we're providing complimentary CEUs for licensed social workers and licensed professional counselors within the state of Texas. If you have a different license in Texas or a license outside of Texas, you can go through the process and get a certificate, submit it to your jurisdiction, and they may or may not take it. I will say, and I've said it, I say it every time. I've had people tell me they've had their jurisdictions take them, but there's no guarantee. I've also had jurisdictions reach out to me for additional information on programs we've done, and to decide whether it met their threshold for CEU credits. So go through the process, get it, submit it, but just know there's no guarantee. The same guidelines go for certificates of attendance. Today's webinar is worth 1.5 hours of CEU credits. You must complete the entire live webinar until and I know we're going to get off early today, and it's that's not, you're not obligated to stay on until 11:30 if we finish before that. But if we go past that, then you would be required to stay on until 11:30. You must also complete the Google evaluation survey. It should pop up as you close out of Zoom. It should just ask if you'd like to take a short survey. That is the link to our Google evaluation survey. That link will also be emailed to you in a follow-up email later today. The Google evaluation survey will be available till the 16th of this month. And please give us till the 16th of next month to get the certificates out to you. Anybody have anything else? I will say we're taking a break. Go ahead, I'm sorry.
Oh, no, go ahead and finish that.
I will say we're going to be taking a break from the midweek Medicare presentations. We do this each year at this time of year, and we will get the word out to you when we start back up, usually in September or October sometime, but you know, we just have to wait and see how funding goes and that type of thing. So once we know, we know, and believe it or not, there is a lot of things up in the air regarding funding.
Right,
It's crazy right now. So
yes, yes.
so
we would suggest you know, talking to people, letting them know that some of the programs that are free to our individuals in our communities could be affected. And so, yes, as Marty said, the funding is in jeopardy.
and all we can ask is that, you know, everyone advocate. You know, just like you advocate for your patient in the hospital, you advocate for things that are helpful to you, and you do that through your local representatives. You advocate. It takes advocating, because when they start cutting funding, you know, I think the squeaky wheel gets the funds is really what it happens. I think is the more noise that's made, the more likely programs are going to get funded. And if you've been listening to the media at all, you know there's just a lot of this going on right now, and we are subject to it just like everyone else. So please advocate.
There was one other question I see, actually, it was in the chat about if Medicare covers knee and ankle and wrist braces or wraps. And yes, generally, Medicare will cover it if it is considered durable medical equipment and if it's medically necessary. So as far as if it's specifically covered, that really depends on the type of brace and whether it's considered, you know, rigid or semi-rigid or support or whatever. So it's really important to check with the provider to make sure that they are prescribing something that is covered by Medicare.
The somebody asked about helping with Medicare penalties, and then Susan, I'll answer your question next. Did anybody have a question, have an answer to that? Did you see that?
Oh, okay. I was asking if
it's in the chat.
Okay, I see. The program that helps cover the penalties, if it's through Part B or D, would be the Medicare savings programs. I'm sorry, Part B would be the Medicare savings programs. Part D would be through the low income subsidy programs. So they could contact the SHIP or search online to see what the income and asset limits are for those programs. And that would cover the Part B or Part D penalties.
And,
If they're don't think there are any other programs that I can think of.
Susan, the answer to your question is your state and federal and state representatives.
And
Whoever you vote
local
for,
representatives. Mm-hmm.
whoever you vote for in your where you live, and whoever you can go on and do a search for who represents me, and it will allow you to type in your address, and it will give you the names of your representatives if you do, and the contact information for them if you're not aware of them. But these are federal. Right now, we're talking about funds being cut at state and federal levels for all sorts of programs. And again, we're being looked at with that as well. And so, the only way to do anything about it is to try to get the people that benefit from the services we provide to let their state and local representatives know that these are valuable to you and important to be funded. Anything else?
Richard asked about bilingual services. Area Agency on Aging does use an interpreter line, and also we do have colleagues who speak Spanish, such as Simon.
Sí,
We
yo
have
hablo español.
a couple other staff members who speak Spanish. And then we do have a few other languages available, but we do have a language line that we can use. And I know Senior Medicare Patrol has documents that they can translate into many languages. Angel, do
Yeah.
you want to provide more information on that?
Yeah, so all of our services are also bilingual. So everything is available in English and Spanish. So any of the reporting and all of our presentations, and then also any reporting or any calls that are made, we do also use a translation line. And so we can accept any language. And we're also able to translate any of our materials into other languages. We just can't promise that we're able to present in them. So right now, just English and Spanish for presenting, but we'll get there.
Mm-hmm. And the great thing too, with Senior Medicare Patrol, they talked about the healthcare tracker. They have that in multiple languages: Chinese, Spanish, was it Korean?
It's Korean, isn't it? I think it is
We
Korean.
had Korean available as well, Vietnamese, Chinese.
Vietnamese. Mm-hmm.
Yes.
So yeah, those are great. And we've been able to utilize those.
I know in our program, Melinda has in her team a sign language interpreter.
Yeah,
And
Leslie.
I believe the Better Business Bureau Education Foundation, do you have somebody that can do sign language interpretation for a one-on-one basis?
So we do not have anybody on staff that's able to do that. We can look at maybe perhaps utilizing a service. So if anybody has any resources or know of any services out there, please feel free to connect me with them. That would be great. But at the moment, no, we don't.
Yeah.
And
Angel or Valerie, if one of you could go over what Senior Medicare Patrol is one more time.
Yes, of course. So we've introduced ourselves right as the Better Business Bureau Education Foundation. And so we are a program within that. The Senior Medicare Patrol is a federally funded program that is available nationwide. Us here, we are specific to the state of Texas. And what we do is we educate folks about Medicare fraud, error, and abuse. And we do that through counseling, education, and we also do Medicare fraud reporting. So any sort of potential Medicare fraud that you're seeing, any Medicare scams that you're seeing, or you're just not sure, it just looks a little fishy, you can actually call and report that to us. And then we build out those cases and send it to the appropriate Medicare fraud control units. So that's what we do here, is we just educate completely for free the public for Medicare fraud. And then also we are the reporting agency here in Texas for Medicare fraud. And thank you for
Thank-
sharing that hotline number, Melinda. Our hotline
Mhm.
number is in the chat. Everything is completely toll-free, available to the public.
All right. Thank you very
Great.
much for that, Angel. And Judith, thank you very much for letting us know about North Carolina. And maybe there's some way we can get connected with colleges here that maybe have the ASL available.
Oh, that would be
Great.
great. Thank you, Judith.
Yeah, that's great. That's great. Well, Melinda, Simon, Valerie, Angel, thank you all so very much. Once again, just a great, great program. You know, as you can see, how much appreciation is being shown. Thank you all so very, very much. Thank you all for joining us. Please look
Yes.
out for our flyer for when, hopefully, if and when we get started up later this year, back in providing the MIDWEEK Medicare. We do have our other webinars going on, so please watch out for that as well. And I'm starting to get caught up on getting presentations up on the YouTube channel as well. Thanks to somebody who came up with a brilliant solution for me to overcome a problem I've been having for months. So we're working on that. So thank you all for joining us. Stay tuned, and y'all have a wonderful day.